Hey guys, it's Doc Heps here with UroCoach. So you've got some bladder control issues and you're wondering what might help. We'll talk about some common myths about bladder control and we'll go over some treatment options, so stay tuned. Hey guys, it's Doc Heps here with UroCoach. So I'm going to talk about some common myths and misconceptions about bladder control and urinary incontinence. We partnered with Medtronic Pelvic Health to help identify some common myths and also to go over some treatment options that may be effective for you. Make sure you subscribe, like, comment, and stay tuned to the end where I'll talk about some advanced treatment options that you may not be quite familiar with. So here's myth number one. Incontinence is a normal part of aging, and that's just false. While incontinence is very common, affecting 1 out of 6 folks in the United States, it's not considered a normal part of aging. Myth number two, leakage affects only women. Well, while women do have more bladder problems than men, incontinence can occur in men very commonly, and we commonly treat this problem. Myth number three, incontinence affects only older people, and that's just false. Incontinence affects people from all age groups. And myth number four, there's no good treatment options for urinary leakage and bladder control problems, and that's just false. The good news is there's a lot of great options for treatment and improvement of bladder health and urinary control. So we'll do a quick rundown. First step is just talk to your doctor. He'll go over your symptoms and provides a treatment plan. Usually we start with lifestyle changes, including diet, exercise, and pelvic floor physical therapy. And if those aren't effective, oftentimes we'll incorporate some medications. The problem is that medications can have some side effects or they just don't hit the target. So if those options are not quite doing the job, then we can talk about advanced treatment options. One of which is injection of neurotoxin into the bladder that can temporarily control bladder control and incontinence issues. Another great option is something called sacral neuromodulation, such as the Medtronic InterStim systems. So what happens is there's an abnormal communication between the brain and the bladder. What the InterStim system tries to do is gently stimulate the sacral nerve to help correct that abnormal communication between the brain and the bladder, subsequently helping improve incontinence and bladder control. This can be a great option for the right person. So how do you know what's right for you? First step is just talk to your doctor. Tell them about your symptoms. I'll also include a link to talkleaks.com where you can get some information and take a short quiz that will help guide you as to the next step. Thanks again for watching. Make sure you subscribe, like, comment, and talk to your doctor.